Welcome to our video on mental health in the LGBTQ+ community.
Before we start, please consider that some contents on this video may contain topics that you find difficult or distressing. If any of these feelings come up while watching, please stop the video and seek for appropriate support. You can find the resources at the end on the video description.
Who are we? We are trainee children's wellbeing practitioners, and we provide early intervention and prevention support for children and young people who may be experiencing mild to moderate low mood, anxiety and behaviours of concern. Our CWP service lies within Southwark CAMHS. We offer guided self-help interventions and work with parents of children aged 5 to 11 who may be experiencing anxiety and behaviours of concern, and we work directly with young people over the age of 11 who may be experiencing low mood or anxiety.
With this video, we aim to explore 4 things. Firstly, the common mental health difficulties that young people in the LGBTQ+ community face. Then, explore the prevalence of mental health needs and the barriers that young people within this community face when trying to access mental health services. And also consider how is our team, Southwark CAMHS, responding to these needs. And lastly, discuss different ways to access the support needed.
We will now explore some of the common mental health difficulties experienced by those who identify as being part of the LGBTQ+ community. This won't capture all of the mental health difficulties experienced, only the most common ones. What we know is that research has shown that people who identify as LGBTQ+ are more likely to experience mental health difficulties than those who do not. One particular study has shown that LGBTQ+ young people were more than 3 times as likely to experience depression as their peers. Another study has shown that these young people also have higher rates of self-harm and suicide compared to those who are not from the LGBTQ+ community. A final important piece of research has shown that young people from this community are more likely to experience mental health difficulties, but beyond this, they are less likely to seek out specialist support due to fears of discrimination.
Now, let's take a closer look into what research has found about the prevalence of suicidal thoughts and self-harm in the LGBTQ+ community. A recent project has found that 45% of LGBTQ+ youth has seriously considered attempting suicide in the past year. Also, a report from 2017 showed that lesbian and bisexual young women presented higher rates of suicidal thoughts and self-harm when compared to women in the general population. Finally, a school report has found that LGBTQ+ young people of color are more likely to have thought about taking their own life than white LGBTQ+ young people. As we can see from research, there is a significant need for support in this community.
We will now highlight some experiences that young people in the LGBTQ+ community have of mental health services. This is particularly important when thinking about how we can increase the accessibility of services to this group of young people and the barriers that may currently exist. As you can see on the slide, 1 in 8 young people who identify as LGBTQ+ have experienced unequal treatment from healthcare staff simply because of their identification with this community. 1 in 7 young people who identify as LGBTQ+ have avoided treatment because of their fears of discrimination. With regards to mental health, 53% of young people who identify as LGBTQ+ felt both in school and at home they did not have somebody they could talk to about their mental health. One study revealed that 16% of these young people had a negative experience of mental health services due to their sexual orientation, and 38% stated having had a negative experience of mental health services due to their gender identity. The same study found that 27% felt embarrassed about accessing services and 16% felt embarrassed to go and talk to their GP.
Let's go over what we're doing in Southwark CAMHS to support young people in the LGBTQ+ community. Firstly, King's College Hospital has a sexual clinic that young people can attend to free of charge. It's called Clinic Q and is an inclusive transsexual health and well-being space. Also in Southwark CAMHS, we think about the young person's overall support network. We may signpost them to local community or charity groups to connect with other young people from the LGBTQ+ community. Additionally, clinicians are asked and receive training to consider sexuality and gender identity as part of the broader assessment and formulation. We also have team discussions around how gender identity interacts with different characteristics. We think about what it's like for a young person from the LGBTQ+ community to grow up or live within a particular social, religious, or family culture. Lastly, any member of staff can become a rainbow champion and can also join the SLAM LGBTQ+ network for peer support.
We recognise that there is still a long way to go in terms of making services more accessible to young people who identify as LGBTQ+, and ensuring that these young people feel they have a safe space to be able to talk about the mental health difficulties they are experiencing. So please let us know what we can do better and how we can ensure these young people who identify as LGBTQ+ can access our service. As well as letting us know what we can do better, please do also let us know if there's anything you think we aren't doing or aren't doing right. Please feel free to use the QR code on the slide if you wish to leave us any feedback.
That young people find the support they need and deserve. There are different charities and organizations that work with the LGBTQ+ community. Albert Kennedy Trust supports young LGBTQ+ people aged 16 to 25. Gender Intelligence is a trans-led charity that works to increase the quality of trans people's lives, especially those under the age of 25. Iman supports LGBTQ+ Muslims and also provides an online forum where people can share their experiences and ask for help. LGBT Consortium is a database where you can search for LGBTQ+ groups, projects and organizations and find services near you, including mental health services. Stonewall offers help and advice for LGBTQ+ people and their allies. Switchboard LGBT Helpline offers information and support with all their volunteers being LGBTQ+ themselves. And Mine is a trusted website that provides a list of organizations offering mental health support for LGBTQ+ people.
Please talk to your GP or your school if you want to be referred to CAMHS for support with your mental health. If you or someone you know needs urgent support with their mental health, please call the CAMHS crisis line at 0203 228 5980 or SLAM's 24-hour crisis line at 0800 731 2864. You can also attend your local hospital's A&E.
Thank you so much for listening to us, and please do give us feedback about how we could better support young people from the LGBTQ+ community. Also, please share this video with your friends and family so that we can all raise awareness together.